Welcome friends to the Colorectal Surgeon. I am Dr. Samrat Jankar. Today we are going to talk a first video about the piles. What is piles? I know many of us know about the piles. Someone will call hemorrhoid as a medical terminology. A layperson may call perianal lump. Sometimes he call perianal problem. Sometimes he call perianal pain as a piles. What is exactly piles? Piles is nothing but there is a swollen vein around the anal region. These are nothing but anal cushions. Anal cushions are an internal part of the anus which contribute significantly for anal continence. Anal continence means we are sitting at any place like animal, it's not going to leave the fecal material at any point. We can hold it, we can control. And voluntarily, when we get a proper place which is socially acceptable, then only the anal region relaxes and the stool evacuates. That's what the human beings are made. In that, the continence is most important factor which decide when to control, when to release, and where the anal cushion contribute significantly for your continence. But when this anal cushion, which is formed of connective tissue and veins, when they swallow, then that is called as a pile mass. That can be swollen inside, that can be swollen and coming out, going by itself, or swollen outside, we need to push it, or swollen and forming lump which is not going inside. That's our grades of the piles. So at the start, why piles comes? Piles comes because might be aging, that area get relaxes because of piles forms. Might be during pregnancy because of pressure in the abdomen, piles forms. Other than that, most common reason for piles is constipation. We are straining, sitting in the toilet, watching the mobile, and forget that we are putting the pressure at the anal cushions. Because of repeated pressure, repeated straining, repeated sitting for longer time, that area becomes swollen, the cushion becomes swollen, and they get the friction and they swallow and come out, and sometimes bleeds. Bleeding is like the drop of water which can come suddenly from the anal region, which create the fear for anyone. That's what the piles is. So other than the constipation, there are many factors involved. Your obesity, your lifestyle, your dietary habit, those all contribute to piles formation. Is it the piles life-threatening problem? Absolutely not. But whatever come in the perianal region, is it the pile? It's also not. The piles is something benign disease which come inside. It can be lying inside the anal canal, swollen, it is internal pile. It can be seen outside, it is external pile. Sometime it come outside, get clot stuck in and become painful. It is something called thrombose pile. It can be one of the emergency scenario of the pile where we need to manage. Usually piles come with a symptom of swelling, come with a symptom of something is coming out, or some bleeding, or some itching, some pain may come. But usually piles bleeding is painless bleeding, it will come. So if there is a piles, you need to consult a proper surgeon, qualified surgeon or qualified colorectal surgeon to get the proper guidance. Rule out anything else is there inside. Most of the piles, almost 90%, can be treated medically with good lifestyle, dietary management and proper few medications. But in some patients, maybe grade 3 or grade 4 or prolapse piles may need surgical care. At the same time, it's most important thing not about the treating piles, it's more important is ruling out in suspected case anything else other than the piles. So friends, piles are not a matter of shame. Piles is a common problem which can happen means almost for 50% of the population can go across the piles over the lifespan. It is a very common problem. Don't keep shame, don't feel embarrassed. Meet an expert, get the guidance and get the proper treatment after proper evaluation, and most of them can be cured with simple change in the lifestyle, dietary pattern, and few medication will help you to come out of the piles problem. Thank you. Don't forget to subscribe our channel, The Colorectal Surgeon, and also watch our tomorrow video on piles. Different topic will be going to be there across the month.